For more than half the disability patients I see, pain is an important component of their disability. 3 days ago, I did a day of disability exams. I did 18, and I was struck by the difficulty many patients had describing their pain effectively. So I decided to make this video. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams. I've done over 1,500, and as usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, really, how to describe your pain doesn't just apply to disability exams. It can apply to someone trying to describe their back pain for disability, but it could also help someone trying to describe their abdominal pain on a visit to the emergency department, or a person with chest pain who's called the ambulance. It can apply anytime you need to see a doctor for pain. So first, I'm going to tell you what not to do. When I ask patients, please describe your pain, 90% of them say it's excruciating. That's not much of a help for two reasons. The first reason is it's what everyone says, so it doesn't differentiate you from any other patient. And number two, it's a given that if you're applying for disability based on pain, the pain isn't minor or trivial. It has to be fairly severe. Now, here's what does help. Number one, describe the location of the pain. Where do you feel it most intensely? If you can, point with one finger to the worst spot. Number two, does the pain spread or travel anywhere from that spot? If it does, describe that. Number three, the timing. Is the pain there all the time? Does it come and go? Number four, what doctors call exacerbating factors. Are there things that make the pain worse? Are there movements, physical activity, bright lights in the case of migraine? Anything that makes your pain worse. Number five, what doctors call relieving factors. What helps or makes the pain less? Common relieving factors are resting, icing the area, applying heat to the area, pain medication, muscle relaxers, injections given by doctors, chiropractic manipulation, or surgery such as joint replacement. Number six, and most important, how does your pain limit your work-related abilities? Keep in mind, Social Security doesn't approve a disability application based on the patient's report of pain alone. The pain must limit work-related abilities, and they would like there to be objective signs of disease. Number seven, what doctors call the character of the pain. What does it feel like? Some common descriptions are sharp, like being cut or stabbed with a knife, dull, squeezing, burning, cramping, electric shock-like or zapping, and sometimes it's very difficult to describe pain. You just can't put it into words. And if that's the case, just say so. There's nothing wrong with that. Now finally, I'm going to give you an example of how to describe pain. And this is based on pain that I get. About 2 to 3 times a year, my low back flares up and is painful. The location is at the bottom of my low back, just to the right of the midline. The pain doesn't spread or travel anywhere. It feels like a nail is stuck in my back. It's made worse by bending forward and heavy lifting. I know because I've tried that lifting over 40 pounds makes it worse. and it does limit my work-related abilities to a small extent. When I do disability exams, I have to bend forward quite a bit. Normally, I can bend forward at least 90 degrees. When my back is flaring up, it's maybe 45, 50 degrees. Well, I hope that's been helpful. If you have found it helpful, I'd appreciate it if you'd subscribe to my channel. And as always, remember, if it happens, it's possible.